The Public Services Commission has directed government agencies to immediately implement the shift system and encourage workers to also take their leave. It is part of the wide-ranging measures to break the chain of COVID-19 infections at workplaces. The Ghana Health Service, in its recent update, identified workplace outbreaks as one of the major sources of infections contributing to the country's third wave. Many of those cases are now critical, with ICUs now stretched. The Public Services Commission says it is important to now decongest the offices to break the chain of infections. Let's get more on this because Dr. Janet Ampedu-Fofie, who's chairperson of the Public Services Commission, joins us via Zoom. First, tell us why the Public Services Commission is issuing this circular at this time.
Good afternoon, and thank you to you, and good afternoon to your listeners from the Public Services Commission. We're grateful to come and share with you this circular that we just reissued. Actually, it's a reissue. It's not a new publication. So this is the third time we've had to go back to the public services journey to remind all of us, both the public services and those of our clients who come into our offices, to be mindful of this very, very serious situation that we are confronted with. The first circular actually was issued in March of 2020. It was reissued when COVID started getting out of control in 2021, January of 2021. And with the current upsurge, the Commission met and found it necessary to remind all public service organizations that those guidelines that were given and provided to them early on still have to be adhered to. And so this is a reminder. It's not a new one that we're coming out with, but it's just a reissue to remind everybody in the public services, both the governing boards that are already in place, those that are yet to come in, the leaders of the public services, our CEOs and the like, to ensure that we continue adhering to the guidelines that were published early on, the two earlier ones in 2020 and earlier this year.
Dr. Fofie, okay, go ahead.
Okay, all we are reinforcing and reiterating is that, as is obvious and from the President's address, the 26th update that we got, we all now know that Delta is here, and it's not a joke. And so we need to be very, very careful, and we need to go back to all the things that we are supposed to be doing. So we're asking the governing boards and councils and the CEOs, the leadership of the public services of Ghana, to go back and remind and put these things in writing to all our people, and particularly our staff. But we also want to remind the public that do come to us in our offices, that indeed when they come in, they need to be ready to adhere if indeed we are to continue doing the work that we are expected to do. So generally, it's not a new circular, it's a reissue of a circular that has been put out there already, and we're asking our managers, we're asking our leaders to pick it up and to reissue at their level and let everybody know that indeed COVID is still here, and as directed by the President, we are to adhere to all the guidelines.
Okay.
And so this is an effort in that line.
So let's look at the guidelines that you have issued. Exactly what do you demand employers to do?
Indeed, if you look at it, there are a few things that we're asking us to continue adhering to. We're to limit as much as possible the face-to-face interactions. The period that COVID has been with us has shown us and proven to all of us that indeed we can continue doing our business and continue doing working on our mandates. But we don't always have to meet people face to face. So we're asking them to limit as much as possible all face-to-face contacts, meetings, conferences, workshops, and the like. In addition, we're asking them to seriously consider all the alternative technology advances that we have. Zoom is with us. Government has deployed teams, and at this point, all public service organizations and entities should have the Zoom, which is really the approved method of communication, electronic communication by the public sector. And we are all to use the virtual applications that are available to us, the WhatsApps and all of that, and limit as much as possible the face-to-face contacts. We're also asking for the managers and for the governing boards to ensure that indeed the supply of the sanitizers and the running water and all the things that we need to make sure that indeed we are adhering to the protocols that have been laid out by the Ghana Health Service are in place. Because we cannot just talk about them. We as managers will have to make sure that these things are available for the use of our staff as well as for those who come to visit us. Social distancing, again, very, very important. I think at the last check, most public service were running shifts. They were working from home. They were working all forms of hybrid work environments. So some were combining it, encouraging public officers to continue these hybrid work environments. And we're not telling you to do one or the other. You need to look at your circumstances and adopt the ones that are most favorable in terms of what you have to do to make sure that we limit these contacts as much as possible. So these are the main ones that we're encouraging most of our people to continue adhering to. And we're hopeful that they've done this and done it very well in the past. So we're continuing to rely on them that they'll continue adhering to this so that COVID will be kept to a minimum as far as the workplace is concerned.
Dr. Fofie, are these measures binding? If they are, what are the monitoring? Do you have a monitoring scheme to monitor and see if people are really abiding by this? And if they do not, are there sanctions for flouters of this guideline?
I think the guidelines in the public services, we try to actually encourage and all of us to adhere to them. So the sanctions are important, but especially with what we are presented with COVID, the sanctions are not the most important. We have to appeal to the consciences and to our leaders to lead and to make sure that indeed they are monitoring. The Public Services Commission cannot go to every public service entity to monitor. We monitor through reports that we request and have sent to us. So we can tell, for example, we want public service organizations to share with us what are the measures that they put in place in terms of getting this done. And so they will send us their recommendations or what they actually have in place. And we will review them and share with each other the ones that are working and the ones that are not working. But when it comes to the implementation, the Commission's work really is to make sure that people have these guidelines and they are to report back to us in terms of how they're implementing these guidelines. We trust and we've had our leaders do a pretty good job with the implementation, and the boards, the senior managers, the CEOs and their deputies are the primary people responsible for ensuring that these things are done. And where there are problems, we encourage them to come so that we can all get together and think through. We work very, very closely with the Ghana Health Services, for example. And so when there's something that we need, if there are referrals that we need to make to them, we are in constant touch with the Director General, Ghana Health Service, and with all the services, so that when issues come, we can very, very quickly group and get together and find solutions for them, particularly with the COVID and the situation that we have on our hands at this time.
Thank you very much, Dr. Janet Ampedu Fofie. She's chairperson for the Public Services Commissions that issued this circulation and warning workplaces to put in place measures to help contain the spread of COVID-19 virus.